1. What is the primary cause of muscle weakness in patients with myasthenia gravis? A. Viral infection. B. Autoimmune attack on acetylcholine receptors. C. Degeneration of dopamine neurons. D. Blockage of cerebral arteries. Answer: autoimmune attack on acetylcholine receptors. Rationale: myasthenia gravis is an autoimmune disorder where antibodies attack acetylcholine receptors at the neuromuscular junction, impairing muscle contraction. Option B is correct. Option A is unrelated. Option C describes Parkinson's. Option D relates to stroke. 2. Which symptom is most characteristic of acute stroke? A. Gradual memory loss. B. Sudden unilateral weakness. C. Chronic hand tremors.
D. Persistent migraines.
Answer: sudden unilateral weakness. Rationale: stroke typically presents with sudden onset of symptoms like weakness on one side due to interrupted brain blood flow. Option B is correct. Option A suggests dementia. Option C fits Parkinson's. Option D is unrelated to acute stroke. 3. What is a key risk factor for developing epilepsy? A. High cholesterol. B. Traumatic brain injury. C. Excessive caffeine intake. D. Low blood sugar. Answer: traumatic brain injury. Rationale: traumatic brain injury can damage neural tissue, increasing seizure risk, a major epilepsy cause. Option B is correct. Options A, C, and D may trigger seizures, but aren't primary risk factors. 4. Which diagnostic test is most commonly used to confirm a stroke? A. Electroencephalogram, EEG. B. CT scan of the brain. C. Lumbar puncture. D. Blood glucose test. Answer: CT scan of the brain. Rationale: a CT scan quickly identifies bleeding or ischemia in the brain, confirming stroke type. Option B is correct. Option A assesses seizures. Option C checks CSF. Option D rules out hypoglycemia, not stroke. 5. What is the first-line treatment for managing acute seizures in epilepsy? A. Physical therapy. B. Anticonvulsant medication. C. Dietary restriction. D. Surgical resection. Answer: anticonvulsant medication. Rationale: anticonvulsants like phenytoin stop seizures by stabilizing neural activity. Option B is correct. Option A aids mobility, not seizures. Option C may help long-term, e.g., ketogenic diet. Option D is for refractory cases. 6. Which complication is most associated with chronic multiple sclerosis? A. Liver failure. B. Muscle spasticity. C. Hearing loss. D. Kidney stones. Answer: muscle spasticity. Rationale: MS causes demyelination, leading to spasticity as nerve signals misfire. Option B is correct. Options A, C, and D are unrelated to MS's neurological effects. 7. What should a nurse teach a patient to prevent falls with Parkinson's disease? A. Walk quickly to build strength. B. Use a cane and clear walkways. C. Avoid all mobility aids. D. Keep lights off to rest eyes. Answer: use a cane and clear walkways. Rationale: Parkinson's impairs balance. A cane and clear paths reduce fall risk. Option B is correct. Option A risks falls. Option C ignores support needs. Option D decreases visibility. 8. Which cranial nerve is primarily affected in Bell's palsy? A. Trigeminal, V. B. Facial, 7. C. Vagus, X. D. Hypoglossal, 12. Answer: facial, 7. Rationale: Bell's palsy affects the facial nerve 7, causing unilateral facial weakness. Option B is correct. Options A, C, and D affect sensation, visceral function, and tongue movement, respectively. 9. What is a common early symptom of Alzheimer's disease? A. Sudden vision loss. B. Short-term memory loss. C. Severe muscle rigidity. D. Frequent seizures. Answer: short-term memory loss. Rationale: Alzheimer's begins with memory deficits, especially short-term recall, due to brain plaque buildup. Option B is correct. Options A, C, and D align with other conditions, not early Alzheimer's. 10. Which imaging is most useful for diagnosing multiple sclerosis? A. X-ray of the spine. B. MRI of the brain and spinal cord. C. Ultrasound of the brain. D. PET scan of the skull. Answer: MRI of the brain and spinal cord. Rationale: MRI detects demyelinating lesions in MS, confirming diagnosis. Option B is correct. Option A misses soft tissue. Option C isn't used for MS. Option D assesses metabolism, not structure. 11. What should a nurse monitor in a patient post-stroke for complications? A. Blood glucose levels only. B. Signs of increased intracranial pressure. C. Hair growth patterns. D. Nail bed color only. Answer: signs of increased intracranial pressure. Rationale: post-stroke, swelling can raise ICP, a life-threatening complication. Option B is correct. Options A, C, and D are unrelated or less urgent in this context. 12. Which medication is commonly used to manage Parkinson's symptoms? A. Levodopa.
B. Insulin.
C. Antibiotics. D. Antihistamines. Answer: levodopa. Rationale: levodopa replaces dopamine, easing Parkinson's motor symptoms. Option A is correct. Options B, C, and D treat diabetes, infections, and allergies, not Parkinson's. 13. What is a key risk factor for hemorrhagic stroke? A. High blood pressure. B. Low cholesterol. C. Regular exercise. D. Vitamin D deficiency. Answer: high blood pressure. Rationale: hypertension weakens blood vessels, increasing hemorrhagic stroke risk. Option A is correct. Options B, C, and D don't directly cause vessel rupture. 14. Which assessment finding indicates a seizure in progress? A. Steady gait and clear speech. B. Rhythmic muscle jerking. C. Normal pupil response. D. Calm and alert behavior. Answer: rhythmic muscle jerking. Rationale: seizures often cause uncontrolled, rhythmic jerking due to abnormal brain activity. Option B is correct. Options A, C, and D indicate normal function, not seizures. 15. What should a nurse do first during a tonic-clonic seizure? A. Restrain the patient's arms. B. Protect the patient from injury. C. Insert a tongue depressor. D. Administer oxygen immediately. Answer: protect the patient from injury. Rationale: safety is the priority. Clearing hazards prevents harm during a seizure. Option B is correct. Options A and C risk injury. Option D follows if needed, not first. 16. Which complication is linked to long-term epilepsy? A. Osteoporosis. B. Status epilepticus. C. Vision improvement. D. Enhanced memory. Answer: status epilepticus. Rationale: prolonged or repeated seizures, status epilepticus, are a severe epilepsy complication. Option B is correct. Options A, C, and D are unrelated or opposite effects. 17. What should a nurse teach to reduce stroke risk? A. Increase saturated fat intake. B. Control hypertension and quit smoking. C. Avoid all physical activity. D. Drink alcohol daily. Answer: control hypertension and quit smoking. Rationale: managing BP and quitting smoking reduce vascular damage, key stroke preventions. Option B is correct. Options A, C, and D increase risk. 18. Which neurological disorder is characterized by intention tremors? A. Stroke. B. Cerebellar ataxia. C. Myasthenia gravis. D. Alzheimer's disease. Answer: cerebellar ataxia. Rationale: cerebellar ataxia involves coordination issues, including intention tremors during movement. Option B is correct. Options A, C, and D present weakness or memory issues, not tremors. 19. What lab test helps monitor phenytoin levels in epilepsy treatment? A. Blood glucose. B. Serum phenytoin level. C. Liver function tests only. D. Complete blood count. Answer: serum phenytoin level. Rationale: monitoring phenytoin levels ensures therapeutic range and prevents toxicity. Option B is correct. Options A, C, and D assess other factors, not drug levels directly. 20. Which non-pharmacological strategy helps manage MS fatigue? A. High-intensity exercise daily. B. Energy conservation techniques. C. Prolonged sun exposure. D. Skipping rest periods. Answer: energy conservation techniques. Rationale: pacing activities reduces fatigue in MS by managing energy use. Option B is correct. Options A, C, and D worsen fatigue or symptoms like heat sensitivity. 21. What is the primary pathophysiological feature of Parkinson's disease? A. Loss of myelin sheaths. B. Dopamine deficiency in the basal ganglia. C. Excessive acetylcholine production. D. Cerebral artery occlusion. Answer: dopamine deficiency in the basal ganglia. Rationale: Parkinson's results from dopamine loss in the substantia nigra, affecting movement control. Option B is correct. Option A describes MS. Option C is opposite. Option D relates to stroke. 22. Which symptom indicates a worsening of Guillain-Barré syndrome? A. Improved muscle strength. B. Ascending paralysis reaching the diaphragm. C. Clear speech improvement. D. Stable reflexes. Answer: ascending paralysis reaching the diaphragm. Rationale: GBS progresses with ascending paralysis. Diaphragm involvement signals respiratory risk. Option B is correct. Options A, C, and D suggest improvement, not worsening. 23. What is a major risk factor for developing a brain aneurysm? A. Low blood pressure. B. Hypertension. C. Regular aerobic exercise. D. High fiber diet. Answer: hypertension. Rationale: high BP weakens vessel walls, increasing aneurysm risk. Option B is correct. Options A, C, and D reduce vascular stress, not aneurysm likelihood. 24. Which diagnostic tool is most effective for detecting epilepsy? A. MRI of the brain. B. Electroencephalogram, EEG. C. Blood pressure monitoring. D. Spinal X-ray. Answer: electroencephalogram, EEG. Rationale: EEG measures brain electrical activity, identifying seizure patterns in epilepsy. Option B is correct. Option A finds structural issues. Option C and D are unrelated. 25. What is the first-line treatment for acute migraine relief? A. Opioid analgesics. B. Triptans like sumatriptan. C. Antidepressants. D. Muscle relaxants. Answer: triptans like sumatriptan. Rationale: triptans target serotonin receptors, relieving migraine pain and symptoms effectively. Option B is correct. Options A, C, and D treat other conditions or are less specific. 26. Which complication is most common in untreated stroke patients? A. Improved mobility. B. Brain edema. C. Enhanced cognition. D. Reduced blood pressure. Answer: brain edema. Rationale: untreated stroke can cause swelling, edema, from tissue damage, raising ICP. Option B is correct. Options A, C, and D are positive outcomes, not complications. 27. What should a nurse teach a patient with epilepsy to avoid triggers? A. Skip sleep to stay alert. B. Maintain a regular sleep schedule. C. Increase alcohol consumption. D. Avoid hydration. Answer: maintain a regular sleep schedule. Rationale: sleep deprivation triggers seizures. A regular schedule prevents this. Option B is correct. Options A, C, and D increase seizure risk via sleep loss, alcohol, or dehydration. 28. Which cranial nerve deficit causes difficulty swallowing in stroke? A. Optic, 2. B. Glossopharyngeal, 9. C. Trigeminal, V. D. Abducens, 6. Answer: glossopharyngeal, 9. Rationale: the glossopharyngeal nerve 9 controls swallowing. Its damage in stroke impairs this function. Option B is correct. Options A, C, and D affect vision, sensation, and eye movement. 29. What is a hallmark symptom of Huntington's disease? A. Intention tremor. B. Chorea, involuntary movements. C. Muscle flexity. D. Improved coordination. Answer: chorea, involuntary movements. Rationale: Huntington's causes chorea due to basal ganglia degeneration. Option B is correct. Option A fits cerebellar issues. Options C and D are opposite of Huntington's effects. 30. Which test confirms a suspected brain tumor diagnosis? A. Blood culture. B. MRI with contrast. C. Urine analysis. D. Chest X-ray. Answer: MRI with contrast. Rationale: MRI with contrast visualizes brain tumors clearly, confirming location and size. Option B is correct. Options A, C, and D assess infection, kidneys, or lungs, not tumors. 31. What should a nurse monitor in a patient with increased ICP post-TBI? A. Pupil response and consciousness. B. Skin temperature only. C. Hair condition. D. Nail growth rate. Answer: pupil response and consciousness. Rationale: ICP changes cause pupil dilation and altered LOC, critical signs to monitor. Option A is correct. Options B, C, and D are unrelated to ICP effects. 32. Which medication is used to reduce spasticity in multiple sclerosis? A. Baclofen. B. Levothyroxine. C. Metformin. D. Atorvastatin. Answer: Baclofen. Rationale: Baclofen relaxes muscles, reducing MS spasticity. Option A is correct. Options B, C, and D treat thyroid, diabetes, and cholesterol, not spasticity. 33. What is a genetic risk factor for Alzheimer's disease? A. APO, E4 gene variant. B.
High sodium intake.
C. Regular exercise. D. Low vitamin C levels. Answer: APO, E4 gene variant. Rationale: the APOE, E4 gene increases Alzheimer's risk by affecting amyloid buildup. Option A is correct. Options B, C, and D are lifestyle factors, not genetic. 34. Which finding suggests a patient is having a partial seizure? A. Full loss of consciousness. B. Localized twitching without LOC loss. C. Steady breathing pattern. D. Normal speech during event. Answer: localized twitching without LOC loss. Rationale: partial seizures affect one area, causing twitching without losing awareness. Option B is correct. Options A, C, and D fit generalized seizures or normal states. 35. What should a nurse do first when a patient with meningitis shows neck stiffness? A. Administer antibiotics. B. Assess neurological status. C. Apply a warm compress. D. Encourage neck exercises. Answer: assess neurological status. Rationale: assessing first, e.g., LOC, pupils, evaluates meningitis severity, guiding care. Option B is priority. Options A, C, and D act without data or worsen symptoms. 36. Which complication is linked to chronic Parkinson's disease? A. Enhanced reflexes. B. Aspiration pneumonia. C. Improved balance. D. Clearer speech. Answer: aspiration pneumonia. Rationale: swallowing issues in late Parkinson's increase aspiration risk, leading to pneumonia. Option B is correct. Options A, C, and D are opposite of progression. 37. What should a nurse teach to prevent head injury in older adults? A. Avoid helmets during activities. B. Wear a helmet and remove hazards. C. Walk in dim light for relaxation. D. Skip regular eye checkups. Answer: wear a helmet and remove hazards. Rationale: helmets and clear paths reduce injury risk in falls. Option B is correct. Options A, C, and D increase danger via lack of protection or poor visibility. 38. Which neurological condition causes a resting tremor? A. multiple sclerosis. B. Parkinson's disease. C. Stroke. D. Myasthenia gravis. Answer: Parkinson's disease. Rationale: Parkinson's features a resting tremor due to dopamine loss. Option B is correct. Options A, C, and D cause spasticity, weakness, or fatigue, not resting tremors. 39. What lab test is critical before starting anticonvulsants for seizures? A. Liver function tests. B. Blood glucose only. C. Thyroid hormone levels. D. Cholesterol panel. Answer: liver function tests. Rationale: many anticonvulsants are metabolized by the liver. Baseline LFTs prevent toxicity. Option A is correct. Options B, C, and D assess unrelated systems. 40. Which non-pharmacological intervention helps stroke recovery? A. Bed rest for months. B. Physical therapy for mobility. C. Avoiding all stimulation. D. High-sugar diet. Answer: physical therapy for mobility. Rationale: PT improves strength and coordination post-stroke. Option B is correct. Options A, C, and D hinder recovery or are unrelated. 41. What is the primary mode of transmission for bacterial meningitis? A. Blood transfusion. B. Respiratory droplets. C. Contaminated food. D. Insect bites. Answer: respiratory droplets. Rationale: bacterial meningitis, e.g. meningococcal, spreads via droplets from coughing or sneezing. Option B is correct. Options A, C, and D fit other diseases, not meningitis. 42. Which symptom suggests worsening intracranial pressure? A. Improved vision. B. Projectile vomiting. C. Increased appetite. D. Steady gait. Answer: projectile vomiting. Rationale: projectile vomiting signals rising ICP due to brainstem pressure. Option B is correct. Options A, C, and D indicate normal or improving function, not ICP. 43. What is a key risk factor for developing multiple sclerosis? A. Vitamin D deficiency. B. High-protein diet. C. Excessive sun exposure. D. Low stress levels. Answer: vitamin D deficiency. Rationale: low vitamin D is linked to MS risk, possibly due to immune effects. Option A is correct. Options B, C, and D are unrelated or protective. 44. Which imaging confirms a traumatic brain injury diagnosis? A. CT scan of the head. B. Abdominal ultrasound. C. Chest X-ray. D. Knee MRI. Answer: CT scan of the head. Rationale: a CT scan detects bleeding or swelling in TBI quickly. Option A is correct. Options B, C, and D assess unrelated areas. 45. What is the primary treatment goal for myasthenia gravis? A. Cure the disease completely. B. Improve muscle strength and function. C. Reduce blood pressure. D. Prevent seizures. Answer: improve muscle strength and function. Rationale: MG treatment, e.g. pyridostigmine, aims to enhance neuromuscular transmission, not cure. Option B is correct. Options A, C, and D misalign with MG goals. 46. Which complication is associated with prolonged immobility in stroke? A. Enhanced circulation. B. Pressure ulcers. C. Improved muscle tone. D. Faster wound healing. Answer: pressure ulcers. Rationale: immobility in stroke patients causes skin breakdown from pressure. Option B is correct. Options A, C, and D are opposite effects of immobility. 47. What should a nurse teach a patient with migraines to avoid triggers? A. Maintain irregular sleep. B. Identify and avoid specific foods. C. Increase loud noise exposure. D. Skip hydration. Answer: identify and avoid specific foods. Rationale: foods like caffeine or MSG trigger migraines. Avoiding them helps prevention. Option B is correct. Options A, C, and D worsen triggers. 48. Which condition causes progressive muscle weakness and atrophy? A. Amyotrophic lateral sclerosis, ALS. B. Epilepsy.
C. Migraine.
D. Bell's palsy. Answer: amyotrophic lateral sclerosis, ALS. Rationale: ALS degenerates motor neurons, causing weakness and atrophy. Option A is correct. Options B, C, and D affect seizures, pain, or facial nerves, not progressive atrophy. 49. What test monitors for bleeding risk in stroke thrombolytic therapy? A. Platelet count. B. Blood sugar level. C. Cholesterol level. D. Thyroid function. Answer: platelet count. Rationale: platelet count assesses bleeding risk before thrombolytics like TPA. Option A is correct. Options B, C, and D monitor other conditions, not bleeding risk. 50. Which strategy helps manage cognitive decline in Alzheimer's? A. Complex multitasking daily. B. Structured routines and memory aids. C. Avoiding social interaction. D. High-stress activities. Answer: structured routines and memory aids. Rationale: routines and aids, e.g., calendars, support memory in Alzheimer's. Option B is correct. Options A, C, and D overwhelm or isolate, worsening decline.